Hi everyone, my name is Vincenza Bartholomew. I'm a graduate research assistant for the Urban Catholic Teacher Corps, and our video today comes to you through a partnership with the Archdiocese of Boston and Boston College to educate Catholic school teachers about special education topics. Today I have with us Allison Manaman. Allison, can you tell us a little bit about yourself?
Sure. So I'm a doctoral student here at Boston College and a longtime special educator. I also teach some of the master's level special education classes here at Boston College.
Alright, so today Allison is going to talk to us about anxiety disorders. So, what are anxiety disorders? What can you tell me about them?
So anxiety disorders kind of fall under the umbrella of emotional behavioral disorders. Actually, they're the most common emotional behavioral disorders in children, so it's a good one to talk about. Usually there are different ways that anxiety disorders manifest. So typically students might exhibit one or two of these manifestations, but not necessarily all of them. We also say that the characteristics need to be present, or symptoms need to be present, for at least 6 months to constitute a disorder or a disability. So the different manifestations of anxiety disorder that we see are phobia of an object or a situation, excessive, unrealistic worry that's not linked to a recent event, and typically we also refer to that as kind of a generalized anxiety disorder. Panic disorder, and that's characterized by panic attacks that have physical symptoms associated with them, and those physical symptoms could be things like increased heart rate, blackouts, dizziness, anything like that. We can also see obsessive compulsive disorder, or OCD, and that's kind of an uncontrollable recurring pattern of thoughts or behaviors, and the obsessive refers to the thoughts and compulsive refers to the behaviors. Or we can see post-traumatic stress disorder, or PTSD, and those are uncontrollable flashbacks or other symptoms that are associated with a psychologically distressing event. And those psychologically distressing events could be anything like abuse, being the victim of violence or being witness to violence, experiencing wars or natural disasters. Any of those things can kind of trigger PTSD.
Right, so what are some strategies that teachers can use if they have a student with anxiety disorders in their classroom?
That's a good question. So these different manifestations of anxiety disorder, if you kind of boil them all down to their core, we could say that anxiety is a tendency to worry about the future in the present. So the strategies that I have for you, the first three are kind of geared towards preventing or reducing anxiety in the classroom. The last three are more like responses to anxiety when it happens. So the first thing that teachers want to make sure to do is to establish and observe a classroom routine. If students know what to expect day in and day out, then they have to do less worrying about what's coming in the future. Every day we like to post a daily schedule. The one caveat to that is we really want to be sure that the schedule is firm. If we're not sure about something, then posting and changing can actually be problematic. Along that line, we want to make sure to avoid surprises. So we know in any school situation, sometimes surprises are unavoidable, but we want to do what we can to avoid them. And that includes things like giving your principal or other administrators a heads up that it might not be a great idea for this particular student if they just pop in for an observation or pop in to say hello. That advanced warning for anything irregular, it needs to happen with that classroom. If a student has had anxiety or is demonstrating anxiety, there are a few things that we want to make sure that we kind of follow through on. The first is we want to make sure that students finish the assignment or whatever it was that they were working on when they needed to take a break because of the anxiety. We like to always kind of come back to the present, and that might mean giving them extra time, and that's okay, or allowing them to finish it later. We never want to punish, not like, oh, you have to stay in at recess, but we need to be flexible but try to maintain the expectations. The last strategy that teachers might like is grounding techniques. So particularly if students are really worked up in the kind of in the throes of anxiety, grounding techniques are techniques that help reconnect them to the present. So there are lots of different grounding techniques, and you can actually Google those, although I'm going to show you one today. It's a little more concrete than some, so it tends to work really well for students. So what you want to say to a student is, tell me 5 things that you can see right now, and then let them, tell you the 5 things. Okay, tell me 4 things that you can hear right now. Then tell me 3 things that you can feel right now, 2 things that you can smell right now, and tell me 1 thing that you can taste right now. So really they're having to kind of access their environment and their existence in the present to try to touch base with those senses And then kind of the regression of number also is a nice way to kind of come back to where we are. So that's one that tends to work fairly well a lot of the times.
All right, excellent. Well, thank you so much. Thank you so much for taking the time to watch this video today. It was brought to you by the Urban Catholic Teacher Corps in conjunction with the Archdiocese of Boston and faculty from Boston College. If you have any questions or would like to learn more about the Special Education Professional Development Initiative, reach out to us at these options here. Thank you.